Welcome to Integrative Medicine Perspective. I'm Dr. Wenli Liu. Turning the body into a more alkaline condition is one of the most frequent topics that I discuss with my patients in my clinic, especially when it comes to cancer prevention and treatment. It is widely believed that cancer cells do not survive well in an alkaline condition. So people try to follow alkaline diets and drink alkaline water in order to provide the body an alkaline condition. The most frequent questions I have encountered are, what is the perfect pH of my drinking water? How much of the high pH water should I drink? And how do I know if I have already turned my body alkaline? So I think I would share some of the discussions I have had with my patients about the topics of body pH. We know chemically the neutral pH is 7. Our body's pH, however, varies significantly from one area to the other, with the highest acidity in the stomach. Our stomach juice is very acidic, with a pH range of 1.5 to 3.5. It is more acidic than pure lemon juice. Why does our body keep the stomach juice so acidic? One benefit is that the high acidity kills bacteria. The foods we eat are not sterile all the time. Plus, we swallow bacteria all the time. So the stomach acid is quite effective against infection. Secondly, the high acidity is one of the initial steps of food digestion. It prepares the foods for the actions of the digestive enzymes later on. Plus, some nutrients require an acidic environment for absorption. Iron is a classic example of it. Finally, the acidic stomach juice neutralizes bile and pancreatic juice, which is alkalotic. The neutralized environment is the optimal condition for the actions of the digestive enzymes and for nutrient absorption in the small bowel. Indeed, when there is severe stomach acid deficiency, malnutrition can occur. But under certain clinical conditions, anti-acid treatments are absolutely necessary. Besides the stomach, there are other areas in our body that are acidic: the skin, the urinary tract, and the vagina. These acidic environments can also help prevent infection. Now we have talked about the acidic parts of the body. Let's focus on the most important alkalotic part of the body, the blood. Under normal conditions, the blood pH is slightly alkalotic, with a normal range tightly controlled within 7.35 to 7.45. Any slight shift below or above the range can cause a significant amount of physiological disturbances. The body maintains the normal blood pH mainly through the works of the lungs and the kidneys. The lungs can alter the blood pH very quickly, in less than a minute, by either getting rid of or retaining the acid, carbon dioxide. Hyperventilation, breathing really fast, can get rid of a large amount of acid, carbon dioxide, in a very short amount of time. So the blood pH can go up very quickly, but the result can be very uncomfortable. Muscle spasms and fainting can even occur. One mechanism could be, with an elevated blood pH, the hemoglobin, which is the protein carrying oxygen in the red blood cells, will hold onto the oxygen molecules very tightly, so they are not easily released into the tissues. Imagine the oxygen molecules are not effectively released into the muscles and the brain. On top of that, an elevated blood pH can cause significant shifts of electrolytes, which can also result in physiological disturbances, muscle spasm, for one. The kidneys, however, regulate the blood pH not as fast as the lungs, but they have a tremendous amount of capacity to do so. The kidneys regulate the blood pH through either getting rid of more acid or getting rid of more base. Depending on the kidney's action, the urine pH can vary significantly from quite acidic to alkalotic, a range about 4.6 to 8. The urine pH can be affected by many factors, so it does not necessarily reflect the pH of the drinking water. Plus, 60% of our body weight is water. That is 90 pounds in a person weighing 150 pounds. So compared with the amount of water we drink every day, which is roughly about 1.5 to 3 pounds, 90 pounds of water is a tremendous amount of buffer. Plus the works of our lungs and kidneys, the blood pH will remain within the range of 7.35 to 7.45. And that is good. Vegetables and fruits can increase urine citric concentration, which result in elevated urine pH. They have so many health benefits, including cancer prevention. So dietary intake of vegetables and fruits is often used as a marker, an indicator of a healthy diet. But an elevated urine pH cannot be used as an indicator of a healthy body condition. I hope this answers some of your questions about the body's pH. Please leave comments and questions. For more integrated medicine topics, please subscribe. I will see you soon.